We can look in Australia. Australia has the same tendency of doing many tests, of doing the same type of assays. But what we see here, we see that the mortality is actually higher now than what it was in April and May. And do not forget, Australia has the reverse seasons, so they have winter now. And also in Chile, we see that the mortality is tracking the number of cases. So what we see in Europe, it's not just case dynamics, it's not just counting people who are not actually ill. There is a biological difference between virus here and virus here. And we know that the virus did not change. So the sequence of virus is the same, genetics of virus is the same, there are no mutations that made it benign. It had to be something else, which we believe is the weather. Have as a point of my talk, these people are actually in contact with virus, they have virus in the nose, but they're not ill. They do not have COVID-19. They only have a virus in the nose. And what I believe underlies these differences which we are seeing is the simple fact that COVID-19 is a respiratory disease, SARS-CoV-2 is a respiratory virus, it disappears in summer. Like all other respiratory viruses, all other coronaviruses disappear in April, late April, come back in December. Influenza behaves the same, some other respiratory viruses. So respiratory viruses can also be found in the summer, like what we are seeing here, but we don't see people dying from respiratory viruses in the summer, neither from SARS-CoV-2 nor from influenza. These do the same thing. They're catching the viruses, and then the flow of mucus is taking them away from our airways and from our lungs. And this is how humans and all other animals survive viral infections. They trap viruses, they take them away. Majority of time and in most of situations. But this mechanism evolved before we invented heating. Heating exists for the maybe couple of hundreds of years or maybe a little bit longer, that people are using heating to make their homes warm in the winter. It is nice to have a warm home in the winter, but the problem with that is that you're losing humidity. Because humidity, or the amount of water which can be dissolved in the air, is highly dependent on temperature. If the temperature is low, only a small amount of water can be dissolved in the air. So if it's the winter and you look outside and you see it's raining and you think, oh, so humid, you open the window and this humid outside air comes in, but then it gets heated. And the amount of water, which is 100% humidity at 5 or 10 degrees, is a very low humidity at 25 degrees. So this air, when you warm it up in your room, becomes a very dry air. And when the air is dry, it's taking water from the surfaces. And one of these surfaces is our airways. So you dry your airways, you breathe the dry air, and the effect is same like this dragon destroying the big wall in the Game of Thrones. You're making holes in your key protection system, and then the viruses can come in. And this is one of the basic mechanisms why respiratory viruses appear in winter and then disappear in summer, or they disappear in the tropical regions where there's a high humidity. And initial studies suggested that SARS-CoV-2 is a typical seasonal virus until there was so much PCR being done. Then there were tens of thousands of cases in Singapore. And they said, no, virus is spreading also in Singapore. This is not a seasonal virus. But then you look and there is, I don't know, 24, 25 people who died in Singapore. So I say, yes, this is a seasonal virus. It is spreading, but it is not killing. It enters your nose, stays in your nose, cannot enter the lung, there's no pneumonia, you're not dying. So this is molecular biology. And the question was, how can we prove this in this COVID pandemics, because number of infected people, number of dead people, this is completely uncomparable between countries, but also within countries in a different time. So this is so unreliable that you cannot do any real analysis on the data of infected people and people who died. So we said, okay, let's look at people who are already infected, who are hospitalized, and see what will happen with them depending on a time when they got ill. And the first big data set we got was from the Hospital del Mar in Barcelona. And these are, on this graph, you can see green dots are people who survived, yellow dots are people who died. This is the number of days they stayed in a hospital, and this is when they were accepted. And then you see that with the spring coming on, and this is Barcelona, so already in April, it's very nice weather. People were staying in the hospital very short, nobody was dying, people were dying mostly here. And then when you look at different parameters of severity, which you look like the need to go to intensive care, the need for mechanical ventilation, mortality risk, they were all falling virtually to zero when the spring came in. This is one hospital. There are many different reasons. Maybe physicians are so smarter now than what they were 2 months ago. Maybe the patients were younger. You cannot make conclusion on one hospital. But then we went to other hospitals and checked Bergamo, Coburg, Milano, Nottingham, Warsaw, Zagreb. And in all these hospitals, we were saying the same thing. And the meta-analysis showed that the odds ratio for surviving was increasing by approximately 2% for every day. So if you were accepted to the hospital 10 days later, approximately, it's multiplying, it's not adding, but approximately 20%, your chances would be better. And with few months, the mortality risk decreased between 5 and 10-fold. So, of course, the first question is exactly what you asked. Is it that we're now seeing younger patients and then the old patients already died out? And the age did not change. So in the period we were tracking, the age of patients more or less the same, actually even increasing a bit in Zagreb. So it is not that we were having old patients here and then young patients here. So age was not a factor in this equation. What is one of the factors, I agree completely with you, this is not the only factor, but definitely temperature was something which stayed significant. That the coronaviruses are seasonal, that other respiratory viruses are seasonal. This is, for example, 10 years of influenza in, I believe, New York and Texas, and humidity, infections, humidity goes up, influenza goes down, humidity goes down, influenza goes up. So respiratory viruses are seasonal, and the easiest way to think about it is, you get a hygrometer. These are the small instruments which measure humidity. Actually, I have one here. This is €1 investment. On AliExpress, you pay €1 and you get this tiny little machine with batteries included, and you can check your humidity. And now I have 52, which is good. And if I go below 40, I should do something. I should return humidity to my room, especially if I sleep. And there are some suggestions from this paper, from this big annual review. This is not from my paper. This is from annual review by Moriam and others. What you should do to try to avoid the risk of respiratory infections. And the final question at the end is, what will happen in winter? And I think the only answer which anybody can say is that we do not know, because there are two aspects. One, what we see in Australia, the disease will be more severe in winter. So if you get infected in winter, you are more likely to get pneumonia than if you're infected in summer. Your mucosas are not working properly, your immunity is lower, vitamin D, whatever. This is worse. Here, when we were opening the country, there was a panic. The virus will come, we all get killed. this did not happen. We opened the schools, this did not happen. We have at the moment total of 24 patients on ventilators, which is, we have, I think, over 800 ventilators. So our healthcare system is not overwhelmed. The country is functioning, more or less everything is still open. In the summer, we had normal summer, we had nightclubs open. And I hope that we also got many people who actually developed immunity in this period, and that we will not be hit by this potential winter wave, which might be more deadly. So this is more or less my story. The median age of people who died is higher than the life expectancy. So we really had mostly old people dying. Because, you know, lockdowns actually work when there is a small number of cases. Lockdowns don't work when there is a large number of cases. If you look at Chile, Chile has this kind of military grade lockdown for, I think, months now, and they still have 1.5 to 2,000 cases a day. So you cannot stop a virus once it is in the population. In a New Zealand situation where there is really a limited number of people, they tracked them, they caught them, they eliminated the virus. But they will have to do it over and over again. And then there were things like Ebola, SARS, diseases which are really deadly. And then they learned, okay, test, trace, isolate. And this is what killed all previous pandemics. And this really works for Ebola, for SARS-1, this worked. The problem is when the SARS-CoV-2 came, this was not a deadly virus. This was a virus which was killing a small, and I think most of Europe was, at least big part of Eastern Europe, was saved by the spring. When you say about the minorities and the pollution and everything else, LA is worse than New York. And LA did not have the same situation. Why? Because LA had a different temperature when it came in. So the reason I'm talking so much about humidity is that this is the only thing which is so easy to fix. You know, you take this tiny little thing, check the humidity, say, oh, it's 30. Take a kettle of water, boil a liter of water, and you're fine. Or buy a fancy humidifier, or just put wet towels over heating bodies, whatever. This is something each of us could do, which will help. It will not be a universal solution, but it will not harm.
But how is it the authorities around the world, not Croatia where you're advising, but just across the world, none of them were interested in mitigating and limiting impacts next winter or even during the peak when you could address metabolic health, humidity? Why did they just don't seem to be interested? They were only interested in lockdowns. That seemed to be the only science that dominated every conversation.
So the way our Prime Minister explained this to me is that all of his colleagues in Europe, they have to show to their voters that they're really trying hard to protect them. They closed the borders. They banned people from some countries to come in. So they have to be the good guys protecting people in their country from danger. And unfortunately, the lockdown narrative is the strongest in the media. So countries which were not doing lockdown, like Sweden, they were being torn apart. And actually, they did not have a politics of infecting everybody. They just didn't have, they have recommendations, and people in Sweden follow recommendations. So they were also doing social distancing, which is normal for Sweden. I know, for example, in Croatia, every month we diagnose 2,000 new cases of cancer, which we did not do for 2 months because of the lockdown. Everything was shut down, hospitals were shut down. So we have 4,000 people who will get much more severe cancer
Now,
because of the lockdown.
You know, because the people just reacting, like as per the WHO 2019 pandemic guidelines, says no lockdowns, no masks. It's written there in black and white. You know, so Sweden just followed the 2019 and before all of history guidelines, even from the WHO. It looks like we got the authoritarian stuff actually from China.